So, you know, what we often do with these folks that have these acute discs, they've got often, you know, back pain, leg symptoms, the buttock, the leg. We're also going as soon as we can to try to move the neural tissue, move these nerves. And at first, when they have an acute disc, is a little bit more challenging because they've got a straight leg raise, usually pretty early on. So we may start to floss the nerve in a little bit of elevation of the leg, starting with just a movement of the ankle. So we'll start by doing some movement of the ankle in dorsiflexion and plantar flexion. 50 to 60 repetitions, no pain for the patient. We'd start with that, give that to the patient. Patient can do this actively at the house, once or twice a day. And if the patient can tolerate that, we'll progress with a movement of the knee. So from the movement of the ankle, we'll go with movement of the knee. Before we do this, you will notice that I place the patient in a slight side bending position. If I do the right side, I'll put the patient in a right side bending to put the neural tissue on slack proximally. And then I'll do some extension of the leg with the ankle and the foot. We can do it like this, or if the patient has a hard time to tolerate this, we also can do it with extension of the knee and plantar flexion of the ankle and dorsiflexion of the ankle and flexion of the knee. So depending on the tolerance of the patient. So instead of the knee, we can also do a movement of the hip, knee and hip, more toward extension, which will be more aggressive and sometimes more at the end of the treatment, making always sure that the patient doesn't have any symptoms while doing these exercise. Now you will notice that I pay attention not to go further than about 60 degrees of flexion at the hip, as is the position in which you have the most distal movement of the lumbosacral tissue. In order to give more slack to the system, we also can place the contralateral leg in flexion. It's very important because it allows the neural tissue to move in relationship to this, because the neural tissue doesn't do well in contact with the disc material. So we try as soon as we can to move the neural tissue so it doesn't stay in contact with the disc material. So for the health of the neural tissue.